At Brooklyn Pharmacy in southeast Portland, signs on the door signal different COVID-related messages to customers, from vaccine availability to the lack of at-home tests.
So far, we've been really lucky, knock on wood, that we have not had any significant illness here, so we hope to continue that.
Owner Pat Hubble says his team is hard at work, filling orders, administering vaccines, and keeping up with safety measures as COVID cases begin to surge.
Protective plexiglass at the counter, spacing on the floor. My pharmacy, we have a small staff, and if we do have a small outbreak here, it can be a situation where we may have to close the doors for a day or two just to see if we can get everybody back on track before, we don't have any issues infecting anybody else.
On a larger scale,
really trying to protect against the tidal wave of community spread that ultimately will be here.
Virginia Garcia's Health and Safety Programs Manager Hazel Wheeler says they're also looking ahead while handling the current strains and shortages many systems are dealing with.
There will definitely be positives. There's just no way around that. And then the exclusions that will result from that and the contact tracing that we'll have to execute will definitely be something that we have to deal with. And I know that we're starting our planning on what that sort of constrained staffing looks like. But to this point, that's not really what the driver is of issues. It's just 2 years of a pandemic.
Kevin Mealy, spokesperson for the Oregon Nurses Association, says staff shortages have been an issue for a long time. So it will be even more of a challenge in the weeks and months ahead with a highly transmissible variant.
So those gaps that were always there are now more apparent because nurses aren't able to be the Band-Aid that stretches over them and holds them together. And the fact that we've been reliant on solutions like traveling nurses and the National Guard speaks to the staffing crisis we're feeling right now. Our hospitals were only able to run at a very stretched emergency capacity with those supports in place. Without them and with more cases, we're looking at a very dire situation.
To deal with the surge in cases and the staffing issues because of it, the ONA recommends bringing back members of the National Guard who filled essential roles during the most recent Delta surge, like bolstered testing and tracing.